In the year 2000, the measles virus was considered to be eradicated in the United States, but it's 19 years later and the disease is back and spreading quickly in certain parts of the country. Airlines and other businesses are bracing for the uncertainty and the economic impact of this outbreak. Joining us right now is National Institute of Allergy and Infectious Diseases Director, Dr. Anthony Fauci. And Doctor, thank you for being with us today.
Good to be with you.
First of all, just run us through the numbers. How bad of an issue is it at this point?
Well, right now in 2019, there have been 695 cases of measles in 22 states. That is already above the next highest year that we've had since 2000. So as you said correctly, this is the worst that it's been since we declared measles eliminated in 2000. And by eliminated, you mean there are no continuous cases over a 12-month period. So we're seeing a resurgence of measles, which is really related definitely to the fact that parents have not been vaccinating their children. There's this movement of vaccine hesitancy or even downright anti-vaccination movement, which has led to a decrease in the relative percentage of people who are infected in certain communities, who are vulnerable in certain communities. That really is a problem. We're seeing a big outbreak in the Williamsburg section of Brooklyn in New York City, in a closed community of Hasidic Jewish people who did not vaccinate their children to the level to keep the blanket of protection over the community. Those are the kind of things that are going around at different parts of the country, which could lead to some serious return of a situation that we essentially eliminated a long time ago.
What does this mean? You boil it down. Many people are vaccinated. If you're vaccinated, can you get it again? I saw some reports last week that maybe some people were only vaccinated once, not the recommended 2 times, if you were vaccinated between the 70s and 80s.
Sure. So if you look at it this way, if you're born before 1957, the chances are that you had been infected with measles like I was. I was born before 1957, so I was infected with measles. I'm protected for the rest of my life. If you've had 2 of the shots, namely the standard way the CDC recommends you get your first shot at 12 to 15 months of age, the second shot at 4 to 6 years of age. If you got those 2, you're 97% protected.
What if you don't know? Should you get it again? Does it harm you to get it twice?
Well, no, it doesn't. And that's a very good point that people are considering right now. Certainly, if you don't know or if you only have 1, there are a couple of things you can do. You can go and get tested to see if you have antibodies, or you can just skip that and get a boost, particularly if you're in an area where there are outbreaks and you're not sure of your status, or if you know you only had 1, it would make sense to get that extra boost to bring your protection up to 97%.
Does measles kill? There have been people who have been pushing back at me online saying it doesn't kill.
Well, that is completely untrue, and I hope that the viewers get that point. Prior to the vaccine availability in the mid-1960s, globally, there were 2 to 3 million deaths per year from measles. In the United States, before we had vaccines, there were about 2 million cases, about 500 deaths per year, about 1,000 cases of encephalitis, which is brain swelling. So the misinformation that measles cannot be a serious disease is just not true.
It's hard to put a number on some of these things, particularly when you're talking about a disease that kills, but UNC did a study and found that vaccine-preventable diseases cost the economy about $9 billion several years ago.
Right.
And if you look at the CDC, they said back in 2013 that every measles case that is hospitalized runs up a tab somewhere between $4,000 and $46,000. Those are dollars that could be spent elsewhere. What are your concerns from an economic perspective?
Well, I think that if you wind up getting more infections and diseases that were vaccine preventable, those are entirely avoidable burdens on the economy. Because when people get sick, they lose work, they lose the finances from work, they have hospital costs, they have direct and indirect costs. These are completely avoidable, and it's really a shame that in the 21st century, in 2019, when you have vaccine-avoidable diseases, that we're not getting vaccinated and essentially putting those diseases to rest like we did with measles in 2000, and unfortunately, it's creeping back on us.
What advice would you give to industries like the airlines in terms of protecting their employees, protecting their passengers?
Well, I think what they need to do, particularly, and several airlines are already doing that, to make sure they go back and check the vaccine status of their employees, of their flight attendants, of their pilots, to make sure they're fully protected.
Are there other areas of the economy, other industries that you think about in a situation like this?
No, I think you pointed them out. I think it's important, travel industries, because people are afraid when they go into a closed place that there is a person, for example, on a plane that might be infected, that you can actually transmit it to the people. One of the problems with measles, unfortunately, on the one hand, measles is one of the most transmissible viruses that we know. And on the other hand, the vaccine for measles is one of the most effective vaccines that we know.
You know, Dr. Fauci, I think one of the points that is often lost on people is that when you get vaccinations, you're creating immunities for people who cannot get those vaccinations. Babies, the elderly, people who have cancer or other reasons for having an immune system that's been compromised.
That is a very important point, and I'm glad you brought that up. That's referred to as herd immunity. When you have in the community about 93 to 97, 95% of the people who are vaccinated against measles, you create an umbrella of what we call protective herd immunity so that the virus doesn't get the opportunity to spread in the community. And the vulnerable people, such as people who are on cancer chemotherapy, who have immune suppression, and even infants from birth until they get their first vaccine in 1 year, those infants are vulnerable. So you protect the more vulnerable when you increase the level of vaccination in the community to that critical level. For measles, it's somewhere between 93 and 95%. If the community is protected at that level, the vulnerable people will be shielded and will be protected.
So, Doctor, when it's eradicated and you have that 12-month period, there's some basal level, I guess, isn't there? It's not really zero. I mean, it doesn't hide somewhere.
Well, it was only in the United States, too. It wasn't globally.
Yeah. We import it on a plane. Yeah.
That's exactly correct. Yeah. Measles throughout the world, for example, last year there were over 100,000 deaths from measles outside of the United States. So continually there's the situation of people coming into the country, and if the country is not protected by that veil of herd immunity, that's when you get the outbreaks.